we're going to be learning breathing into different zones. And this could be classified as spine training, but it is going to have a lot of carryover into a lot of different things that you might be training here. So we are going to be learning how to breathe into 3 zones. Zone 1 is going to be, think about sternum up, okay? So chest breathing, which is not something that we might typically do. In fact, some people might say kind of like avoid that because it can be, have an up regulatory effect, which is not always bad. Getting yourself upregulated is a tool. So there's lots of like the thoracic spine back here, your sternum, your heart, your lungs. There's a lot of stuff here, and a good portion of it is bone and cartilage. So it's a lot of hard stuff. So getting your breath to help us move those harder things is really going to be beneficial. The zone 2 is going to be like the midsection, kind of the soft part of our belly, where like the stomach, some of these other organs are. It's going to be our middle back if we're thinking about our spine. And then zone 3 would be something that I think would typically be classified as belly breathing. It's kind of breathing all the way down to the floor of our thoracic cavity. So like into our pelvic floor, kind of like into our seat, into our butt, into between our legs, into between that hip crease. So zone 3 breathing for me is kind of like waist or belly button down. And so we want to begin to, this is going to be a practice. They can be done at varying intensities, but typically this is done as a way to gain additional afference and access to that stuff. And that just means we want to use the breath to be able to start to map out different things in this region of the body. And then we can locate them better and we can train them better. So for zone 1, I like to just kind of give myself a self block. So I'm kind of like just right at my sternum, and I'm just gonna put my fingertips there, and my thumb is on my ribs in the back. So like that's a hard like protuberance that I'm able to push on, and then my fingertips are just kind of like, this is like the bottom of my rib cage. They're just above the bottom. And with this style of breathing, to make room, we can shrug our shoulders, get our shoulder blades involved, and it's going to be expansion and elevation. This can be very hard to see on camera, and it can take a couple of breaths, even for me, and I do this all the time, for me to get my breath into this region. But a couple sensations that you should try to chase down is a stretch across the chest and a stretch across the thoracic spine. Then when we go to our middle section, I'm going to have my fingertips just lower so that this is my belly button or my waist, and I'm just gonna have my hands kind of in the soft part of my belly, and then same in the back. My hands are kind of on, basically kind of like, not my erectors because my hands aren't that big, but just outside, maybe like where my lats attach, down sort of towards the bottom. So I'm gonna be inhaling and exhaling here. This one is more accessible, but we wanna make sure that we're also breathing into our thumbs. And you want your inhales to get you as big as you can around. And your exhales to naturally collapse you. And so when we're trying to isolate these 3 zones, how I think about it is that when you're going to zone 2, zone 1 is like a hallway. So you have to breathe through that hallway, and then it's gonna open up into this room. And then traveling down into zone 3, I'm gonna have my hands in my hip crease. So kind of like if I had pockets right here, that's where my fingertips are. And then my thumb is just kind of almost just just outside my SI. So there would be my SI and there's my thumb. So this is mostly on soft tissue. And then similarly, zone 1 becomes a hallway, zone 2 becomes a hallway, and then we want to open up that breath down into zone 3. And what we're looking for is, as we inhale, additional pressure underneath our fingertips, because that breath is expanding us both in our low back, in our hips, in our hip crease. And so importantly, we want to make sure that when we are inhaling into that zone 3, into our lower third, that we are also inhaling into our lumbar spine, our low back. We can have particular stiffness in that neck of the woods, and so this breathing can actually help us lengthen and train the spine from the inside. So each of these zones have kind of different things going on in them, but kind of doing this in a either descending or ascending fashion is going to help us get more specific into that training stuff.